specialty with an expert to offer consulting. And I have in the studio with me a real doctor. Yes, I have Dr. Abiola Ajayi. He is the MD CEO, ROA Specialist Hospital, and he's here with us to do justice to the topic of the day. Hello, good morning. I said hello.
Good morning.
Good morning. How's your day been?
Fine. Thank you for having me.
All right, it's good to have you as well. And we will be discussing about what will my mature and retirement age look like. That sounds, really kind of funny. Coming up with this question, so this just looks like, okay, not like the regular.
Yes.
So what should one look like, yes, at one's retirement age?
Yeah, this is just an outline to kind of get the discussion started. A lot of people don't plan their retirement as much as they think they do. A lot of people know that when they get older, they're going to retire, but they don't really have an idea of when and how and exactly what that would look like. So what one should look confident in their retirement age, because they have spent 30 years planning, executing a plan that they put in place. But oftentimes that's not the case. When we're talking about retirement age, we're talking about anywhere from 50, 55 years and older. And by then you should have a handle on any chronic diseases you might have. Handle meaning you're maintaining good values. And when we talk about health, at least we talk about management of chronic diseases, especially management of cardiovascular disease. That's diseases of the heart and the blood vessels around the heart.
Okay. All right, thank you very much on that.
Especially when we take into account, there's something called an X chromosome. Women are XX and men are XY. Women are XX and men are XY. That means your genetic makeup. And because of that X chromosome, it makes things different for women, and especially because women also go through something called menopause between the ages of 45 and 55, where a lot of different hormonal changes occur in the blood, as well as a lot of changes happen in the digestive tract, which we're not really aware of. There's something called normal flora, which are bacteria that naturally live inside your stomach and small intestine and whatnot, and that actually, the makeup of those bacteria change a lot, and it can also cause a lot of differences in changing, especially as we age. And the final one is that we have something called DNA. We know what DNA is as our genetic material, and we have some specific genetic material that's passed strictly along the maternal line, and it relates to how we use and produce energy. So men and women are definitely different at the beginning, in the middle, and at the end of life.
All right. Thank you very much for that.
That's a good question. When you talk about ectopic pregnancy, you're talking about a pregnancy that happens outside of where it's normally it's supposed to be in the middle of the womb. It's an area called the endometrium, and that's where the egg and sperm should meet, and the developing baby should. But at times, the egg doesn't come down far enough before the sperm meets it, or they meet outside, and you can have pregnancies that grow in the ovary or in the fallopian tubes. And once diagnosis, it becomes an emergency, because a lot of those people can end up bleeding to death. So fibroids are different because they typically grow in or around the uterus in their growth. There's very slow growth, as opposed to an ectopic pregnancy, which is an actual pregnancy that is growing outside of the normal area. And once it gets large enough, it can rupture. You have a lot of internal bleeding, and that's how people end up dying.
Okay.
An argument with a patient yesterday that I'm quite close to, and I told him that I was going to divorce him as his doctor, and he said, "Is that possible?" I said, "Yeah, it's possible." I said, I don't want you to tell anybody that I'm your doctor and you continue to ignore some things that are very important. At some point in time, you have to just decide that my health is of paramount importance, and you do what is necessary. When she said something now, and she said it in a way that, stroke, didn't I know that strokes are caused by high blood pressure? That's how grandma was making it sound, and that's the common belief that all strokes are from high blood pressure. In this environment, a lot of them are caused by uncontrolled BP, but you can have a lot of strokes from the opposite, meaning you have a lack of blood flow. Something blocks off a blood vessel in the brain, and some things are usually like cholesterol or platelets or blood clots. So you now have something that cuts off flow of blood to a part of the brain, and you can also have a stroke. So it can be caused by more than just high blood pressure. Unless we're very sure of what caused her own stroke and other people like her, then it's difficult to give that person specific advice, and that means we need to see and examine it. You cannot go through life on your own, especially when you've had a stroke before and you don't have any support. That's too much for one person to handle. Yeah, it's just too much. She's talking about having mobility issues, and so it sounds like she's not had physio. It sounds like nobody has sat down. If I'm not exactly sure what caused her stroke, whether it was high blood pressure or not, and it's hard to give, like I said, specific advice. But somebody like this, we worry about managing of her blood pressure, and then physio to try and retrain parts of her brain so that she can actually start possibly moving again. And the sooner you do these things, the better. Right. This is why we started Hope Medical. We do that medical mission, and we talked about it earlier. This is why, for these kinds of people that say they don't have opportunity to see doctors.
All right.
So maybe she can call later, and we can connect her with our next mission.
All right, thank you very much. Thank you for that.
This is a reoccurring theme. When somebody's having chest pain or chest discomfort, she said it wasn't painful, but it was uncomfortable. When you're having chest pain or chest discomfort in the center of the chest, we worry about the heart. We try and separate the heart out of that. And then we now focus on things like peptic ulcer disease. Okay. And more specifically gastric or stomach ulcers. And she mentioned something there that she felt like that the last time when she was pregnant. And when you're pregnant, the womb gets bigger, it pushes the stomach up, pushes acid up into the throat. So she may be having what we call a reflux, gastric acid reflux, or GERD. There's so many different terms out there on the internet, but with a very easy physical exam where we try her with some medication, we could actually tell the two apart. But you need to be thinking about your heart when you're having these kind of symptoms, and she needs to have done her comprehensive blood work recently. Once you get above the age of 40, I like to tell people once a year, treat yourself on your birthday. And when you talk about comprehensive, it includes kidney functions, liver function, cholesterol, those kind of things. Because by the time you feel differently, when you have high cholesterol clogging the arteries of your heart, by the time it becomes very significant, the arteries are 90% closed already. Okay. So, and that's when people usually start feeling the chest pain, when there's only 10% of space left. And so it's better to do preventative care than chasing problems.
All right, thank you very much.
Two separate issues. One of them, she just talked about high blood pressure in general, that she had it, and she also has PIH, pregnancy induced or high blood pressure just because they're pregnant, which a lot of people suffer from. And when I say a lot of people, millions of pregnancies a year are complicated by high blood pressure alone, and or high blood pressure plus other problems. When you're not pregnant and you're still suffering from high blood pressure, it means that you're actually hypertensive. You have high blood pressure, and you need to be on your medication regularly. And that medication may be different than the medication you take while you're pregnant. That can't be stressed more. So she needs to get a prescription from a competent physician. The other problem when she's describing difficulty breathing when she's walking long distances, that may be from the heart, or it may be from the lungs, things like asthma, or a lot of people hate hearing the word asthma, so I don't use it often. I use hyperactive airway disease. It's all the same thing at the end of the day, but a lot of times when I say the word asthma, sometimes you can see a patient stop listening to you when you're talking. So, but it sounds like she may have that component. The only way I know of telling the difference is that we have some machines that we actually have them blow into and see their peak flow. It's called peak flow. How quickly can air flow from their mouth, and based on some values we can now say, oh, this is probably a heart problem, or this is probably a lung problem.
All right, thank you.
I mean, do you?
I don't know. Is there any pain there?
All pain, all pain. Is
pain.
But when we talk about low back pain, when I say a lot, the majority of us suffer from low back pain at some point in our life. 80% of people will suffer from low back pain, whether it's acute, meaning short term, or chronic, long term. But 80% of us will go through that. Most of the time it's because of narrowed joint space, or something called spondylosis, where the space between the bones of the back start getting narrower because of age or degeneration of the joints, and it now puts pressure on the nerves, and that's why you'll have pain that radiates, pain that starts in one place and moves to another place. It's usually because it's following the path of a nerve. So a careful exam and probably an X-ray, and we'll be able to tell the difference.
Right.
She mentioned 45-year-old male that had blood in the stool, and she said she cut out fizzy drinks to help. On the list of foods to avoid and I think we're going to get to that later, but on the list of foods to avoid, especially for those in retirement age, the first thing I have written in my notes here is sugary drinks. It's number one thing to avoid. And to be honest, all of us should take that advice. Anything you call them minerals or sodas, or any of those sugary, fizzy, all of those types of drinks.
We're supposed to cut it off completely.
Yeah, there's nothing good.
There's
nothing good about those drinks. And I'm going from somebody that used to drink 6 to 10 bottles a day, me personally.
No, I'm not that serious.
To maybe half a bottle every 6 months. Half a bottle every 6 months. That's really a very good
slash.
Yes, a big slash. And since I've done that over the last 2 years, I've seen a huge difference in in how my body works. But number one thing to avoid. Now, if the thing has already happened, you've already seen blood. Whether or not the blood has gone, stopped, you still need to do the needful. There still needs to be an examination of the patient, because you want to make sure that blood is not from cancer. Because sometimes colon cancer or rectal cancer will have blood that comes and goes. And if you catch it early, it's a lot of solution. If you wait till late, then and when he's having pain and constant blood, then it could be something else. So he should still come and be evaluated, especially over the age of 40, for colorectal cancer. It's an examination. You can do it in the office, and then get peace of mind and a clean bill of health.
All right, thank you.
Is you want to. One of the changes that goes on as we get older, we lose muscle mass. And we also lose bone mass. We lose the strength in our bones, and we lose the strength in our muscles. So you want to reduce your exercise. Want to be of what they call low impact exercises that won't put a lot of stress on your joints and your body. So exercises like that are walking. Swimming is the best. It's like one of the best exercises. Period. If you have that opportunity, aerobics is also quite good. Cycling, and dance. Dance is actually a wonderful. Yes, we're all dancing in the studio, and dancing is actually a wonderful exercise.
Okay.
And low impact. So anything you call exercise, you try and do at least 20 minutes at a go, at least 3 times a week, and then you want your heart rate, focusing around your heart rate to increase. Your heart rate has to increase for us to call it exercise. But those are the main ones they should look towards.
And
70%.
yes,
And the exercise part of it
it's
is
30%.
Yeah,
Yes.
yeah.
So what would be the people who are aging and probably are at their retirement age?
Yeah, no person's going to eat the same thing all the time, so it's more of what do we avoid,
Okay.
so that people can have leeway to pick things that they enjoy. And the things you want to avoid, we talk about sugary drinks. I don't know if people eat pizza here as much as people over there do, but pizzas, white bread is one of the major culprits that we have here. Our white bread, which is refined, which has a lot of added sugar and has a lot of the essential nutrients stripped out of it, it's a rather dangerous staple food that we have. As well as breakfast cereals or cereals that you add sugar to, anything that you're adding sugar to is also quite you also want to avoid. And we're also on the list fruit juices. A lot of people think that drinking, I won't name the brands, but drinking different fruit juices are healthy. The more you drink, the better for you. But some of them are not juice. They're not 100% fruit juice. They're if you look on the side of some of them, the more common ones, they'll say 5% juice or 10% juice, and the other 95% of it, yes, a lot of it's water, but a lot of it's sugar. A lot of it is added sugar. They just add sugar to make it sweet. So you have to be very careful about the juices you drink.
All right. Thank you very much.
Little animals, little animals that terrorize you when you're not looking. Difficult one. I need to see. This is somebody that. This is why we. Maybe at the end we'll tell you about our telemedicine initiative, and this is why we need to see people. This is somebody that I need to see, try and recreate the feeling, make sure I'm looking at where she's explaining. The only thing I'll mention here is that there's some infections that actually infect your nerves, and you can have pain, rash, or strange feelings along different lines, and those lines will extend from your back towards your front. And when I say a line, I mean a space of about this is about 4 or 5 centimeters, just in a band. A band is a better word. A band stretching, whether it's along from your back to your front or your front to your back. It sometimes can be caused by a virus that affects your nerves. It's a very common virus. I would start there with her, but unless I see her, I wouldn't really know what other advice to give. Meningitis. Okay, when we talk about meningitis is typically infectious, meaning caused by a bacteria or a virus. And it's very important that as a doctor we kind of know the difference. Which one is this, viral meningitis or is this bacterial meningitis? Because obviously the treatments are very, very much different. Usually somebody with meningitis will usually have a fever, but what they normally complain about is the headache, and it's close to the worst headache, and a stiff neck. Headache and stiff neck. And then we start worrying, and plus or minus a fever, we start worrying about meningitis. If you have meningitis, it's not something I would, meningitis kills people, thousands of people a year. It's a medical emergency. they train us in residency and in medical school even to recognize it quickly so that you can get people on treatment. So this is not something I would entertain on a radio show. If you know you have meningitis, you need to be in front of a doctor. Okay. And obviously I can't treat her without doing my confirmatory test. So adult meningitis can actually take your life, just like neonatal or infant meningitis. So she needs to call in and get in front of and let us take an exam and examine her and confirm that it's actually meningitis.
All right, 24 minutes. Yes.
She mentioned that she has cough and which drug.
What medication should she use?
So that's the problem. I give my number out and I expect people to call. We give our social media handle out. We expect them to send messages, and we get a good portion of these types of messages. Oh, I'm having cough, or I'm having this. What should I use? It's very dangerous to treat yourself that way. When we talk about causes of cough, I could spend 2 hours just talking about the different things that can cause a chronic cough or a cough that persists. And not all of them are infectious. Not all of them are a bacterial infection or a viral infection. Some of them may be an issue with your heart or with your lungs. So sometimes people are not aware that if your lungs are sensitive to pollen or things that float in the air, you can actually have a cough that comes just because your airways are constricted. So this kind of person also needs an exam, a physical exam. We need to see you, touch you, test you, and then we'll now determine the cause of your cough and then treat. But too often, these kind of people will get advice. When the last time I had a cough, I used this drug, and they just start taking it. Meanwhile, you're putting stress on your body, and you're taking things that you're not sure are going to work. So you have to be very careful.
All right. And on this text message here. Okay.
That's a large part of what we do. That's majority of what we do. And we were started by a urologist, and we are currently run by a urologist. So yes, and yes. So make your way down.
All right. And I'm talking about.
I always ask two questions. When I'm seeing a patient, obviously when I'm looking at them, most of the time I can tell their gender. So I don't usually have to ask that question, but I always ask age, and I always ask what kind of work they do. And especially when we talk about people that have chronic pain, especially low back pain, and we're also worrying about for cancers. A lot of people don't know that if you work in a factory and you're exposed to different kinds of dangerous chemicals, it actually increases your risk of cancers. And those cancers, from bladder cancers to lung cancers to so many different types. So your job really makes a difference for cancer risk as well as chronic pain. And I have some people that say, I carried, right now I'm a businessman. I don't do much, but if I dig deeper and ask questions, say, that was up until 2 years ago. 2 years ago, I was a laborer. I used to carry things on my head, and now a person's wondering why they have severe back pain. So job is very important. Exposure, environmental exposure, whether it's at the job or at home, is also very important.
All right.
We do operate on a lot of them. The best thing to do if you want to run away from surgery is you soften your diet completely. Soft diet.
Okay.
Soft diet are things like ogi, and pap, those kind of things. And you take a lot of that high fiber, and then you also want to soak in salts. Do something called sitz baths. You can look it up on your favorite search engine, SITZ, sitz baths. The more often you can do that, you can actually dry up the piles from outside in, and then you'll be able to avoid surgery. For more specific advice, because I can't talk about specific medications, then you can call in.
All right. Hello, do you want to listen over the radio?
Yeah. So not laying doubt to her diagnosis, self-diagnosis. A lot of times I often ask the patient, oh, what do you think you have? I do that for a reason, because a lot of times the patient will know, they know how they feel when they get malaria, they know how they feel when they get, other things. But when you say the flu is a viral infection that has specific symptoms. And it sounds like she actually has allergies, not not the flu. Okay, and you typically, a lot of people treat the flu with antibiotics and all these different things, but typically the flu is caused by a virus. You don't need an antibiotic. You just need to support yourself with nutrients and food, and your immune system will eventually take care of it. So and it's not as common as in this environment as we might think. So. But it sounds like she, when sneezing all the time, she may be having allergies rather than the flu. And of course, allergies cannot be treated with antibiotics. We were going to treat them with completely different medications. So you need a competent diagnostician. Diagnostician is somebody a doctor that can tell you that, no, this is what you have, or this is what you have, so that you go down the right treatment path.
All right.
Meningitis is meaning, it's an infection and irritation of the stomach lining, anywhere from the stomach lining all the way through the colon lining. You typically see it a lot in infants and school-age children, and a lot of times in that group is caused by a virus called a rotavirus. 85% of it is caused by a virus, and it's transmitted what they call fecal-oral route, meaning not that people are putting their hand in their anus. It's that people improperly washing after using the toilet now end up contaminating either someone else's body or food, and it can be transmitted. That way. So, what can you do? Hand washing, or at minimum use sanitizers, and then make sure that you're cooking your food well, and that your water source is properly decontaminated. If you're unsure about your water source, make sure you boil your water before ingestion. And boil is a rolling boil, meaning you're seeing lots of bubbles. Not that you just see some small bubbles at the bottom. You've not gotten hot enough yet. So a rolling boil is, you're seeing lots and lots of bubbles on the surface of the water for at least 5 minutes, and then you can be sure that the water is safer to drink.
Okay.
So the question she asks is, if
HIV.
If you're diagnosed with HIV, is it a death sentence? No. To be answered, to clearly answer a question, no, it's not a death sentence. If you can, I don't know if a lot of you guys know someone named Magic Johnson. He's a very famous basketball player in the States. He declared he had HIV, I think, in 1992. And if you see him today, I actually met him in person last time I was in the States. If you see him today, you can't tell that he has anything, because why? He's a millionaire. He's on medication. He takes it regularly. He exercises. He's watched his diet, all kinds of things. He looks exactly the same as he did, when he was playing professional basketball. So no, it does not have to be a death sentence. And I will commend government for that. They've made some programs where I know in Lagos you can actually go and get diagnosed and get medications. Either it's subsidized or they're free from some of the state hospitals. They actually have HIV clinics, and you attend the clinic monthly or every 3 months and get your medication. And if you're consistent with some of the newer medications, it really does not have to change your quality of life. Okay. Especially if you catch it before it becomes AIDS. You mentioned HIV and not AIDS. Okay, so AIDS is towards the terminal end. So no, but the main thing is consistency with your treatment plan. If you're consistent with your medications, then it does not have to be a death sentence.
Okay.
Yeah. One of the things, so you don't become a burden upon, and we had a caller that mentioned, the people that she didn't want to inconvenience the people that she was living with. I think she had a stroke, before. So, what are the things that can be done is your checkup, your physical checkup. We run something called comprehensive testing, where we'll take blood, run you through all the different departments, and kind of we'll give you a packet letting you know, this is your kidneys, your liver. That's the best thing that you can do for yourself. And the earlier you started, you start thinking about these things from age 40, 45, and up. So you need to find out what, if any, chronic ailments you have and treat them. Okay. So those are the things that, say, look at now, uncontrolled high blood pressure caused her to have a stroke, and now she can't leave the house. Now she's definitely a burden. If she's not a burden on herself, she's a burden to everybody around her. And this is just because of uncontrolled high blood pressure. Okay. And her story is very common, because a lot of people wait until there's a problem. I wait until they have massive headaches before they go to the doctor, and now find out they've had high blood pressure for some time. So the best thing that can be done is to have your checkup, what we call it, well checkup. You're feeling fine, but it's just time. Go and have your checkup. Let your doctor do all the tests that he wants to, and then start from there. I sometimes may tell somebody they have 5 problems. I may say, I'm noticing early diabetes, your prostate is enlarged, you have this, you have that, but we tackle them one by one. So this month, this is what we're going to tackle. Next month, we're going to take on this, and so prioritize them, and keep working on them. That's the best advice I can give. Okay,
so how often does one get to do these comprehensive tests?
I would say, when we're talking about this age group, at least once a year. Okay. At least once a year. Now, when I have somebody that I've identified, if I have somebody I'm treating for hepatitis, I'll probably monitoring them every 3 months. If I have somebody I'm treating for prostate cancer early, I'm probably monitoring them every three months. But the testing should be at least done once a year.
All right. Thank you very much, Dr. Ajayi. But before you go, what will be your final words?
Our final words, especially on on what will my retirement age look like. We talked about health. Some of the other topics. I actually prepared a PowerPoint, so I'm going to put that up on our social media site. I think this afternoon. ROA Specialist Hospital. I think that's our handle. ROA Specialist Hospital for Facebook, Instagram, and YouTube. We'll put more dietary advice, and we'll put some more advice there, and people can also ask questions. So that's my final word. Don't be afraid to ask questions now, rather than wait till later.
All right. Thank you very much for coming to the studio today, Dr. Ajayi. And he is the MD CEO, ROA Specialist Hospital. And if you